Greetings guys, welcome to this channel. Although the title of this topic is how to prepare for the open heart surgery, but can really anyone be prepared for that? I guess not. So in this video I am trying to tell you is that what I have done uh, which helped me to have a speedy recovery, and this should be important to someone who is about to have an open heart surgery. So open heart surgery is going to be one of the most difficult journey, and your body and mind both are going to take a huge toll from there. So knowing the surgery and the recovery is certainly going to help. So I understand that everyone's physical condition is different. So what I have done may not apply to everyone. But some of this is still true regardless of your physical condition. You should discuss with your medical professional to make sure that this makes sense to you. So for me, I had little to no physical symptom prior to the surgery, and I was able to do everything I was doing normally. So I took the opportunity to prepare myself for the surgery. So my recovery time was much better than the average, and by end of second week I was 95% self-sufficient, was able to do almost everything by myself. So the time I received the message that I am going to have an open heart surgery, I started reading all about it, watched interview with people who had the surgery, followed people who had a speedy recovery, and what they have done prior to the surgery and what they think is the reason for their good recovery. So open heart surgery is going to create a huge trauma on your body, and body need lot of energy to recover from it. So how your physical or psychological condition prior to the surgery is going to determine how your recovery is going to be, because the body will try to go back to the previous condition as quickly as possible. So here are the 10 things I have done to prepare myself for the surgery, and if possible you should consider. Be active as much as possible. My doctor cleared me for walking only, and I walked a lot prior to the surgery. I walked at least 4 miles every day, and whenever I had a chance I went for a walk. You may not able to do much other exercise, but building some strength on your core muscle is going to help you in your mobility. After surgery, one of the difficult thing you will find is that getting in and out of the bed, and having some help from the core muscle is certainly going to help. If you have to put too much pressure on your arm while getting in and out of the bed, that is going to create lot of pain in your insertion area, and that is really painful. You can avoid some of it if your core muscle can carry some of your body weight. If that is not possible, try to practice getting in and out of the bed without much arm support. It took me 2 weeks to walk 4 miles a day after the surgery, and I think that was possible because I was walking the same distance prior to the surgery. Eating healthy food. After surgery you won't be able to eat anything for first 3 days, but your body will start recovering and healing the wound as quickly as possible, and for that reason body need lot of energy, and this energy should be stored in your body. Eating healthy food helped me a lot. It even helped me to reduce some extra weight I had, and I believe my immune system is much better. And it makes sense to have heart healthy food prior to the surgery, because after surgery your heart is going to be in the most vulnerable position, and eating heart healthy food prior to the surgery is certainly going to help. Keep a positive mindset. How your mental condition prior to the surgery is going to determine how your body is going to react during the surgery and after that. One of the cardiologists said in one of the interview is that even though your brain is sleeping during the surgery, your body is still active. So prior to the surgery, your mental condition is going to determine how your body is going to react during the surgery. If you are in a good mood before the surgery, then your brain is going to release good hormones which will be present in your body during the surgery, and that is going to determine the behavior of the body. Remember one thing, you have no more control over the outcome, and therefore there are no point to worry about it, which you have no control. You need to trust your surgeon and the medical system. The medical system is far more advanced than you can think of. The chances of having an excellent outcome is very, very high. Know all about the recovery process. I made another video in great details showing day by day progress after my surgery. You can have a look to understand more in details. I will put a link below. The more you know is better. Knowing every details is good because that way you know what to expect and can reason with it. And you can tell yourself why things are happening. For example, breathing tube is going to be one of the most uncomfortable one. Um, but if you know that they are going to remove it as soon as you can breathe by yourself, and you can tell yourself what is happening. Chest tube is going to be another most discomforting and probably the most painful one, but they are going to remove it probably by day 3. So if you know that, then you can tell your mind is that this is temporary. Your pain should not exceed a 3 out of 10 scale, and nurses are going to give you the medication if it goes beyond that. By day 3 you are going to release a lot of gas and that is not going to be present, but that is normal because by that time your gut will wake up and start what it's supposed to do. Another most discomforting is going to be when you are coughing or sneezing. So try to minimize it as much as possible. Don't do anything or eat something which can irritate your throat, and that can create the cough. I realized that black pepper and spicy food irritate my throat and make me cough, so I stopped it. Carry a chest pillow with you all the time. Talk to your friends and family. Getting all kind of physical or mental support is key in your recovery, and you need to plan prior to that. You need to educate yourself as well as your family member because they can help you only if they know how to and what your needs are. Find someone who can take you for walk, because walking is a very important part in your recovery process, and it is important to have someone with you when you are going for a walk at least first few weeks. If someone can prepare food for yourself, that would be great, because you need to limit yourself for eating outside food, because you need to cut salt intake for a while to reduce the extra pressure on your heart. Get up to date with your vaccine. You need to plan to get all the vaccines prior to the surgery. I had flu, COVID-19 booster, shingle, hepatitis B and pneumonia vaccines. You can take only 2 vaccines at a time, and you need to wait 2 more weeks before taking the next set. So for me it took 1 month to get it all. But you must talk to your doctor and plan for that. After surgery, the last thing you want is that any kind of infection or even the cold. A cough is one of the most painful one you can imagine. Dental clearance. You need to get clearance from your dentist to make sure that you don't have any infection or cavity. Without that, they won't perform the surgery. Bacteria from mouth can create huge problem in the heart where the surgery performed. So you need to be very careful. Prepare your bed and chair. You are going to need that. Going in and out of the bed is going to be difficult and create lot of pain in the incision area if it is not done properly. So having a reclining bed or adjustable bed which pillow is going to help. So sleeping on a flat surface is going to be difficult for you. So having these things are going to be helpful. Your sleeping pattern is going to change and you won't be able to sleep a full night because of the medicine or the surgical reason. So you'll be sitting on a chair many nights. So having a good reclining chair is going to definitely help. Apply for short-term disability insurance and buy a walker and shower chair. You need at least 6 to 12 weeks of rest, and you need to get the disability insurance during this time. And these things takes time, so start the process ahead of time. So based on your physical condition, you may need to have a walker or a shower chair. And finally, try to take advantage of the time. I decided to document my experience and share it so that someone else who might be in the same position can get help from there. You need to find your desire your interest. It can be writing a blog or journal or engaging in some activity which you enjoy doing. But doing something and keeping yourself busy will reduce the chance of getting depressed or sad, which is more common than you can think. And 20 to 40% people actually get some kind of depression after the open heart surgery. This surgery probably going to teach you something about life, what is important, what is not. For me, I am trying to appreciate everything from now on, and which was not something I was doing earlier. I hope this video is going to help you to prepare your surgery. Finally, I wish you all the best and thank you for watching me. Take care.